Hey guys, welcome back to another Thursday at 9 a.m. with Dr. O and Ron, and I'm going to introduce you to our extra special guests, which are Dr. Pastor, Ryan Cambio, and his lovely dog, Arrow. And today we're going to be talking about cooperative care, and I will let you guys take it away.
Hi. Dr. Pastor, what is the age of our gathering animal in its entirety?
It's a lot. So I am in charge of the rehab department, and I work with a lot of sport dogs, and I also, my newest project, I guess, is I want to start teaching our patients and our clients some cooperative care. So today, I want to show everyone how cool that is, and how easy that can make all of our lives, and how much happier that can make our patients. And Arrow is going to show us a bunch of behaviors because I'm not a dog trainer. I only play one with my own dog. So
That's right.
I have one here to help me to show everyone maybe some little tidbits on how to train these things. You're not going to get the complete picture in one little session, but you're going to get some great ideas, and hopefully it will encourage people to learn more about cooperative care and make their veterinary visits so much easier.
There's one question that the Park Avenue organization has become fear-free, or is working very hard to become fear-free. So how is it that plays into a fear-free thought process or mentality to give the owners and of course express the dogs and make these visits decrease the FAS score, right? Fear, anxiety, and stress. So the effort that you guys put into educating humans as well as our patients, how is it that you envision that decreasing our FAS ongoing? And I think you and I spoke about getting this going when they're puppies. Like you're like, hey puppy, do whatever you guys.
So what I would love to do is maybe when all the COVID stuff is over, teach puppies that the veterinary hospital is not scary. And from those first little puppy visits, teach them easy behaviors that can, if they're engaging, they're engaging in their treatment. They're not just huddled on a table scared. They can do a chin rest. And if they're getting rewarded for something that they do, well, that's going to change how they feel about being in the veterinary clinic. They're going to get a positive emotional response, and they're not going to think of the clinic as a scary place. And that's going to be great to work into our fear-free paradigm, I guess you would call it. And what I'm really excited about, and I know we talked about this too, is we take every puppy that comes in to see us and we can start them from the ground up, knowing that we're not scary and knowing that they can come in and they can do little tricks and we can still get our exams done. How awesome is this going to be when they're adult dogs? And then maybe they come in for a lameness, but they already know to hold still with their chin rest. And I can do a better exam. We can all do better exams. We can all just keep our patients happier.
And they get the sense that we're not there to hurt them. Like they can come there, they can get a happy experience or a pain-free experience in their puppyhood experience and such. And trust, like medicinal Chinese medicine or acupuncture, the things that you do.
Stillness.
Walking at a dog or a cat with needles, and they're like, I don't even know you. I don't even know you. But I know trust is fundamental, and when we're doing things that when we first meet these guys and they're painful, trying to get that trust issue is like trying to stand in front of a speeding train sometimes. I mean, really. And then
really hard.
For those of you who
Technical difficulty. Sorry about
I
that.
hope none of you guys are seasick right now.
We're having a little issue with our mic, unfortunately,
so
I'm trying to get the mic to work.
In previous episodes of this, usually outside, I believe it was, I've mentioned JJ Blue in our previous episodes, and as some of you may know, that she, she's in heaven right now, and I want to introduce her dad. This is Arrow, her doggy dad, and Arrow is basically like a superhero, and he's a spectacular dog. And if any of you know me, you know that I have absolutely no boundaries with my dogs whatsoever. I practice no discipline with my dog. I mean, like none. So that's why the pictures of JJ that you guys saw on here was her on the kitchen table. this was pictures of her doing other things that other people might think that might be possibly inappropriate. So hopefully that with our episodes today, we can not that I'm not going to let the dog on the kitchen table if they want to be on the kitchen table, right? not what you guys learned here today is going to influence Dr. O'Sullivan's dogs whatsoever, but it should, right? It should. So just so you know, I think that Arrow's a superhero, and Ryan, Aaron's dad and trainer and best buddy and best friend, also a superhero, right? So they're gonna explain things that I actually don't understand, so I'm gonna keep quiet because I actually don't understand it. So off you guys go.
Okay, so my favorite cooperative care behavior is the chin rest. It's lovely. It teaches stillness, and if the dog, I don't think I can teach a cat. Still, you can look at eyes, you can look in their mouth, you can maybe administer that Bordetella vaccine that now we can give in the mouth, but it's still kind of a pain in the butt sometimes. So great behavior. The other thing I love about a chin rest is you can have the owner or technician right now, because we're doing the COVID thing, but they can constantly shovel food in that dog's face while they're being still, and you can do all kinds of stuff. So, Arrow. Oh, and there he is.
So the chin rest is, from a training perspective, a really, really fun behavior. Looking at tricks and different behaviors, a chin rest can be what we call a foundational behavior for a myriad of different, more advanced skills. I use it a lot with, he just noticed there's a camera, he's like, hey. He's a little bit of a ham. But with a chin rest, what we can do is use it in, like Dr. Pastor said, in a myriad of different ways to help aid in the dog's comfort and how relaxed they are during what can be a stressful vet visit. All of my dogs like to try and drag me into the vet. They love coming in to see everybody. And Arrow is a dog who's had some emergencies before, and because of cooperative care and teaching him how to do certain things that'll aid in him being relaxed and, I'm not going to throw it, aid in him being relaxed and make the experience easier on everybody, he doesn't see the vet as something negative ever, not even a little bit. But with the chin rest, it's actually a pretty easy behavior to teach any dog. A lot of dogs know how to lick your hand or how to maybe, or touch. How to touch, I know he wants to do his chin rest, but how to touch your hand with their nose, good boy. And what the chin rest is just a bridge off of that. So the way that we, maybe a dog that didn't know this well, but the way that we teach it is just by kind of, I know, right? Offering our hand under their head, and as soon as they go to move their head down, we reward. And Arrow knows this behavior very, very well. There's a puddle of drool starting in my hand. I know, that's gross. Yes, go away. And then as he, I know there's still food there, but even with their being food on the table, because this behavior is very high value for Arrow, he knows that he's going to be rewarded the more he keeps his head in my hand. And while that's going on, good. A vet can poke, they can prod as they need to, they can check, I know, chin, Arrow chin, good boy. They can poke, they can prod, they can check vitals and do what they need to, while Arrow is distracted about keeping his chin on my hand. The really nice thing about dogs is that, way worse than even humans, they don't multitask. So a dog can't think about being stressed about the thermometer going into unknown venues. And instead, they can only focus on keeping their chin in your hand and how they're going to best get these cookies. These are more cookies. More cookies. Gross. Drool. Doesn't help the drool, but.
Or should have brought a napkin for
I know.
everybody.
We're gonna get him a bit. Yeah,
All right. So chin rest, my fave.
How long does it take to teach a dog to do that? I mean, it's food motivation, it's trust. What is it? What is it that, I mean, because they're next to you, they want food all the time, right?
I like chin rest because it's pretty fast for my dogs. Maybe that's.
Yeah, it is. And the nice thing about
like
chin
so
rest, because it's such a unique behavior, like it doesn't look like anything else except for maybe nose targeting, like a touch or something similar. A dog doesn't have to know anything else prior to learning a chin rest. So you can take a green dog, a dog who doesn't know anything, and teach him a chin rest in a couple of minutes. At least one that's, continuing to be rewarded. So with Arrow, like Arrow knows this behavior super, super well. Wherever I put my hand, he'll, chin, cheater, good boy, no, chin. Actually on my hand, there you go, buddy, good boy. I know, and he'll follow it where, good boy, where I ask him to, good boy. But he's such a cute.
See, you came up with another one. Testing neck range of motion.
Oh, that is.
I love that.
That's very
good.
And you can use it in a myriad of ways. That is a good idea.
It is. And
I'm just going to take notes.
Okay, range of motion.
Cervical range of motion without forcing them to do
Yeah.
that.
Yeah.
I try and chew with the the treats and such, but it's
Yeah.
definitely not that. It's
Yeah.
just basically luring them in, and sometimes they're just like, or they're like, yeah, I don't think so. I don't know.
Yeah, or they're like, no.
But it's
Yeah.
definitely not a disciplined action. It's basically
No.
like a give it to me, give it to me, give it to me, give it to me. So.
Yeah, and it's the nice thing about the chin rest too is that it, not only is it super easy to teach, but kind of by definition with cooperative care, we're rewarding the entire time. Oh my gosh. Sorry, buddy. We're rewarding the entire time the dog is offering the behavior. This isn't, he's still leaving it there. This isn't something where we need them to press and then just leave it there with no reinforcement, no food continuing to come. Hi. So this isn't something where he likes to throw his head in your hand.
He wants to make sure you know it's got there.
It's right there. But I know this isn't something that we need him to do under a ton of distractions or with a bunch of, gross, you gotta chew though, bud. It doesn't help with that either. But it's not something we need him to do with a ton of distractions or for long periods of time in between the rewards. And that's also what makes it really easy to teach even dogs who may not know anything else, because we're rewarding them frequently. And I know, more cookies.
And that's like that's a premise in Fear Free, is that the food rewards for that
Mhm.
decrease in
Yeah,
an
yeah.
effort to decrease FAS and those types of
Yeah.
things. So it
Yeah.
just kind of goes along with that as
It's
well.
kind of physical.
And we distract a lot. I mean, I think kind of your basic fear-free is distraction. So I'm going to go on a tangent.
Uh-oh.
If you want to distract,
That's
lick mats. And this is not an actual lick mat per se. It's a silicone pot holder that I got off Amazon, and you smear peanut butter or cheese on it. These are really hard to clean.
That's right.
So we have different ones for the clinic. But if you just need a distraction, lick mat or snuffle mat. And these crafty people can make these at home. Somebody made this for me. I think this is like a dish mat that goes in a sink.
You can also use
And-
anti-fatigue mats. That's a super common
Oh
one
yeah,
to use for
with
base
the
of
holes.
The ones
Yeah.
that have the holes are tiny little
I don't know.
squares.
And you loop some fleas through
The
that.
things you stand on, not break your back.
Oh, all right, good.
These are
Floor
great
mats.
because
I
you can
got
hide a
it.
bunch of cookies in here, and the dog's just
Snuzzle.
snuffling away,
Schnuzzle.
and,
Yes, they schnuzzle.
and you're back there acupuncturing or
Doing
doing whatever, you know, maybe taking the temperature. You can take that if you want.
Can you wash this?
Yeah, you
Throw it
just
in
chuck
the
it in the
washing
washer. Yeah.
Aaron knows what these are too.
He goes, what is
Just
that?
let me demo that. I can do it. I can do it.
So we need to
So
find more
those-
crafty people.
Yeah,
Yes.
yeah, we need, yeah.
Everybody needs to know somebody who's crafty.
It's true. Okay, my next favorite is counter conditioning for a muzzle. Because muzzles are not bad. Muzzles keep everyone out of trouble. No one gets hurt. And a dog that doesn't care about wearing a muzzle
Yes, good point.
is awesome.
Just wait.
If you have a dog that hasn't worn a muzzle before and you think you need one, you put it on their nose, first thing they're doing is they're swatting and they're trying to pot off and they're all stressed out about that. And that doesn't help with fear, anxiety, and stress. But if you can get the dog to think of this as just another way to earn reinforcement, then it's no big deal. And if, say you think your dog's going to be painful and you really need someone to get in there and feel some things, and you think, wow, they might have feelings about that and bite. If they're used to wearing a muzzle, it's no big deal. Worst they can do is hit me on the head with it.
Yeah. Or on your chin.
Or on the chin, yeah.
Your chin bop.
Nose.
Like,
So,
well, and even from a behavioral perspective too, as a trainer, like it's very easy to see when dogs are wearing muzzles. Whether it's a dog who, whether he knows what it means, but whether it's a dog who may try to nip or bite or mouth or whatever, or whether it's a dog who won't, with a properly fitted muzzle, not only can they breathe just as if, just as if it wasn't on. And that's the purpose of a muzzle like this that I'll explain in a second. But what it also does is it automatically puts everybody at ease. The owner's not worried about their dog accidentally biting the vet. The vet's not worried about getting bit. And the dog's way less stressed automatically because everybody else is. And that anything that we can do, especially in an emergency type situation. Now he's chin resting on the table. It's fantastic. Just put a rag under there and we can soak up that drool.
Chin resting on the table. If you're not going to pay attention to me, then don't.
He knows how to get what he wants. But he's trying to lure Dr. Pastor into giving him. But the beautiful thing about muzzles, and every dog that I own and every dog that I work with, we condition to a basket muzzle. So a basket muzzle is named because the front of it kind of looks like a basket. Arrow with this muzzle, and this is his, he can open his mouth, he can chew food as I hand it to him. If he wanted to drink water while it's on, he's perfectly capable of doing that too. But more than anything, it keeps him relaxed should he, it keeps him relaxed should he be in an emergency situation, painful situation where he needs one, and automatically it keeps everybody else relaxed. Arrow loves his muzzle, very, very much so, and why I'm holding it over here is because he wants to shove his face in it. But the way that we work with muzzles to start to teach dogs that they're not something scary or something, something to avoid, is we teach them how to put it on themselves. And my dogs know this is hat. So I say put on your hat, and they put their face in the, just hold on, keep it together. But they
He's like,
come on now, I know.
I have a list of things you need to do before I give you something. So,
but if I show Arrow, I know. Oh my gosh, buddy. If I show Arrow his hat, he's gonna shove his nose in it because he knows he's gonna get a reward. And the best muzzles to use for things like this are ones, and you can see, that have holes in them. One that obviously aids in respiration and then being able to breathe correctly, especially living in the desert. Just hold on. But you can shove treats through. Are you ready? Are you ready?
so
He gets brave. You've been flying.
I know. Are you ready? Yeah. Yes, good boy. And actually, it's going in there. What he's doing is he's actually chin resting. So he's resting his
combo
head.
He's multitasking.
Trying to. Get it, buddy. I know. Get the piece of food. Good boy. But he's putting his head in the muzzle and resting it in there. I'm not making him do it. I'm not making him stick his nose in. I'm not putting the muzzle on his face. Oh my gosh. He's very impatient about it, but he's doing it entirely of his own volition. He's doing it because there's a ton of value for, there's a ton of value for this, and I can stand here as long as I want, and he's just going to, okay, a little bit impatient today. But he's going to keep sticking his head in the muzzle because he knows that it's something super, super high value to him. And so, no matter where I put it,
more range of motion.
Good, right. Good boy. Good boy. He's just gonna keep sticking his head in here. Good
Ryan,
boy.
have you ever had to rehab a dog off of a muzzle when they've had like bad muzzle experiences? And I'll be honest with you, because the cloth muzzles that we use in the hospital, which we no longer use, we use basket muzzles and what do they call it? Basket muzzles and there's another name for them that are more varied than that.
Mm-hmm.
But the dogs that are used, are not used to it, but they're used as a restraint device for a painful experience, right? And they're strangers; these animals are scared. They get a cloth muzzle on to where they can't breathe well, they can't pant well, or they can't receive treats before even fear-free was part of our lives. That kind of experience with muzzles, which is very restrictive and doesn't decrease your FAS at all. But then have you ever had to kind of rehab dogs?
Absolutely.
Back to muzzles?
Oh yeah, absolutely.
More baskety than, until they can breathe, right?
More baskety. Yeah. Well, it's more comfortable too. And if you think about like restraint,
I love words.
I know words are hard. Words are. There's not enough coffee for words. But restraint with dogs is not something that most people think about teaching.
Yeah.
Stop anticipating. So Arrow knows what I'm about to do. But if I go up to Arrow and I hold his mouth closed, very little pressure, Arrow knows what this means because I taught him to accept if somebody's holding onto your muzzle, it's nothing to be stressed about. Arrow's not tethered, he's not on a leash, he's completely off leash. And if he wanted to leave at any time, he could, and I would let him. But Arrow's doing this because he knows at some point he's going to get a reward. Chin. Good boy. But going back to Chin, I can go to Chin, and if I need to hold his muzzle to look at his eyes, to do OFA eye exam, anything like that, it's infinitely less stressful because he has a positive association with being restrained in this way. Arrow's a sport dog. We do dock diving, we do agility, we do Schutzen, we do all kinds of stuff. And so
all the things.
So Arrow,
except for herding.
Arrow no longer does herding. That is correct. He loves it a whole lot. I know. There's just not time for it.
I would really like to have my own sheep.
He wants his own sheep very bad. Sheep or cattle. I mean, he's really an equal opportunity herder.
He's not a hater.
He is not a hater. He's just a herder. There's got to be a shirt somewhere that says that. But Arrow does acupuncture typically every 3 to 4 weeks, just to maintenance and make sure that we're addressing any soft spots that we need to. And even with that, Arrow can do it completely relaxed, laying down or trying to be upside down and chill about it.
That's hard.
But I trained that. So I don't know if you guys can see that. There's just drool everywhere. He's just. But I taught Arrow how to be relaxed for acupuncture sessions, and we worked on it.
Yeah.
So the first couple of sessions that we did, we weren't actually doing acupuncture. It was just getting Arrow familiar with, okay, this is what it's going. I know. This is what it's going to look like.
Because on film, that's okay.
I think just get that side too. We gotta get that side and that side. But what it's gonna be like, so I need you to lay down on your side and hang out there while Dr. Pastor's over top of you poking and
I'm leaning over the top of you.
And part of it too is feeling if there are any trigger points, Arrow said, if you're gonna fall. If there are any trigger points and if there's any spots that definitely need extra attention, Arrow, you can't chin rest there.
I'll chin rest over here.
She's just soft. So as many people know, depending on how familiar I am with the last year and a half of my life, JJ Blue, who my sweetheart, she was born with dermoids. She was born with skin and hair on her eyes. So she and I spent a lot of time going back and forth to Vegas to go to ophthalmologist, and the ophthalmological examination from the pros is it is holding your muzzle shut and having some stranger that looks like they're a bug with big metal equipment on their head.
the headgear,
get right in your face. And then put lights right in your face and ask happy. They're like this. They're in completely interpersonal space while you're scared, while you're nervous, in an interesting place.
Yeah.
And that they switch up their personal bug gear, and
Mm-hmm.
they're this far from the dogs. And so in my experience, I have 3 blind dogs, 3 blind mice, so 3 blind mice.
Oh my gosh.
But I go to this same ophthalmologist, and I just think he's a hero because of the stuff he does. He just jumps down the floor with these guys, sticks on this, does his stuff this close to these dogs, and then he puts on the metal bug mask and gets this close to these dogs. And he's doing what you're talking about, just putting the pressure on their muzzle, and not through the strain. It's just that he's got to hold because he's got to be looking in a very specific place.
Yeah.
And he does this, and then he does this to their eyes, and he's holding on like this. And when JJ was smaller, and that's what she was smaller. And then when she started saying bad words to people, and then she learned the Roddy Rumble and those types of things, and then she would go back for rechecks and back for rechecks as she got bigger and bigger. And I, I'm the worst owner. I'm like the worst client ever. And seeing her go into the rooms and having the doctor there with his intern there and his technician there, and her being post-operative and post-pain and post-21 eye drops a day dog and those types of things, and going in the room and watching the doctor just come in and like just as relaxed as possible and just doing his thing and dropping to the ground and doing what he just did with his Rottweiler and putting the gear on. I gotta be honest with you, I was that close to having leaving the room. Because I as an owner, and I was so stressed. Mm-hmm. And the thing is that every once in a while, JJ would go and look at me, and I was like,
Fake it till you make it.
Like, okay, I actually can't read you right now. I just really need you not to do anything silly right now. And so there were a couple times where JJ would respond to a stranger in the room in this small, cramped space, and the texts that were doing the tears and this, that, and everything.
Yeah.
And she did fine with the same person, but then Doc and his intern would come in, and there was one time where the doc did his thing, and she was fine. She walked over to this corner and she grabbed something out of a drawer, which she always did, out of trash, out of drawers. I mean, it was like her home. And then she jumped up on the exam table to stare at them, that perfect Roddy thing, like, whoa. And then, so there's an intern, and she did her thief thing. This guy came shooting across the table and like this over her head and grabbed this thing out of her mouth. And I'm like,
that was probably rude.
That is rude.
He was trying to save her from a foreign body. I
Sure.
mean, he was trying to save her from a foreign body. And I'm like, excuse me, I'm gonna go vomit right now. my anxiety level was so through the roof. I'm like,
Oh yeah.
is this actually happening right now? And to be perfectly frank with you, I never trained up JD to a muzzle, which you recommended I do. But I mean, honestly, my stress level as an owner in a room, very calm, with a facial restraint on a growing, attitude-laden dog.
Is that true?
As an owner, I really, as an owner, I couldn't relax. And thankfully, the practitioners there were like Hakuna Matata about it, man. This is what I do every day. It's not a problem. I'm just going to slide on the floor to this big dog, no problems at all. And I'm sitting there as a coffee, I'm like, I need more coffee or less coffee. Do you touch the dog? Don't touch the dog. Do you get involved? I'm like, and you never ever say, positive, of course, and like, shut up and just leave the room for a while. So. But what you're talking about is so important with regard to the stress level in the room. Because if you have a nervous practitioner, or if you're a newbie out of school and you watch this thing walk into the room, holy hell, right?
Yeah, and it's, being aware of the dog that you have.
It's nice or not. You're like,
Oh,
he won't hurt
absolutely.
anybody. It's like, who believes that? But look at him, he's gorgeous and huge.
Well, and looking at the situations that vets and techs and any practitioners, just relax, wait.
I'm starving.
Gross. But the situations that practitioners are in, like as dog owners, like take aside, Arrow said, take aside being, you're gonna fall, being a trainer for a minute, looking at things as a dog owner, it's my responsibility to be aware of my dog being a dog. Like even taking it's very nice. Even taking aside breed or a male dog, female dog, intact, spayed, neutered, whatever, you have a dog. Every dog on earth is fully capable of being uncomfortable in a situation, whether that means that they're trying to growl to say stay away because I'm uncomfortable with what you have to do, or trying to bite because they're in a lot of pain. They're well within their right to do that, but it's our responsibility as owners to best prepare our dogs as much, you look like you're listening, but prepare our dogs as much as possible for making this as relaxed of an environment as possible, or as relaxed of an experience as possible. And so to piggyback back off of how we kind of rehab off of cloth muzzles, or if the dogs had a negative experience with them, the best thing to do first is invest in a basket. Just relax. Invest in a basket muzzle. There are super inexpensive basket muzzles all across the market. Baskerville is a huge favorite of mine. They're like $15, $18. But follow the sizing instructions so that it fits correctly. But hold on. The best thing to do is to actually wrap your muzzle as you're teaching your dog how to get comfortable with their muzzle and stick their head on. Wrap it with something like saran wrap and stick treats inside of it. Like, don't feed your dog out of a bowl as they're getting used to it. Feed them out of the muzzle as a bowl.
That's brilliant.
And because immediately they have to eat. They're going to eat their breakfast. They're going to eat their dinner. Put it in their muzzle. Wrap it so it doesn't fall out, because then it kind of defeats the whole purpose. I know. But as I'm introducing dogs, I typically do it as young puppies, so when they're 8, 10, 12 weeks old.
That's a good idea.
And they get used to doing this so that if they ever need to, you can get this kind of a result with it. And Arrow's never been in this room. Oh, hold on. I know, you're very hungry. Arrow did have breakfast, despite what he believes. You had extra breakfast. Actually, you had the Hobbit breakfast. Okay, we're putting this down. But that being said, because these behaviors are heavily reinforced, and has a very good association with things like the chin rest or his muzzle, wait, he's perfectly willing to offer these behaviors with gusto and a little extra enthusiasm for fun because they are very, very rewarding to him. And these aren't things that you have to practice every single day. As you're first getting your dog used, oh my gosh, I've got to watch how much I talk with my hands around you.
Yeah.
But that wasn't on purpose. I know, it's just ridiculous because as soon as I set my hand out, he's going to start trying to rest on it. But you're
You can
ridiculous.
use a kid. There you go.
Jeez. But as you're first getting your dog used to it, yeah, let them eat their meals, breakfast, lunch, dinner, whatever, out of their muzzle. But then once a week, maybe, spend some extra time if you know your dog has an appointment coming up or if they have a chronic condition that they're going to see a vet regularly for, absolutely be practicing these things frequently. Because ultimately it's helping your dog more than anybody else.
That's true. That's true. It's absolutely true.
Well, and you. I mean, your description of it. So, and I feel a little bad about this. I don't tend to think of owner stress when they come in.
It's a huge
But it's a thing, right?
It's a thing.
No, it's
So-
a real, and the thing is, my stress as an owner was, my stress for as an owner was for the practitioners.
100%.
Yeah.
I'm absolutely the same way.
And not that they're like my kindred spirits, it's not that.
Yeah, but
It's that
yeah.
If that dog who has repeatedly been in uncomfortable situations here, and every
Yeah.
time she comes, it's the same thing over.
Yeah.
And don't get me wrong, nice people. I mean,
Yeah.
they would be fear-free in spades, man. The staff would come out like, oh, she'd roll her back, and she'd love being there. She'd walk in there, she'd like in the front of the check-in counter. She would just lay down, she used to spread herself out like she was army crawling. And then she would just lay there in the middle of the lobby, and she'd block traffic. Then she would just roll over, and everyone would just start laughing like, is she okay? I'm like, she's fine. She's fine. But when she got into the room, and then more staff that got into a small room,
Yeah.
and okay, she's visually impaired. She's auditory overload. She's been traveling 8 hours to get there. Mom doesn't have enough coffee on board, and my
That's huge.
oh my god. Well, like my energy going in there, and she loved being there, but the idea of the things that they had to do just to check her, and the idea that you're going to a visually impaired dog with gear who has had minimal training to do anything other than just be a dog, right?
Yeah.
God help her, she was an Sullivan dog, so she didn't do anything. But the thing is that she was perfect, and she only grumbled once out of the whole time she went there, and it wasn't to the doctor. And so the idea that the doctor's face is that close to those teeth, and I'm like, wow, you're like super brave, and my dog is super awesome, and I am like seriously bad energy in this room. But I was concerned about the practitioner because any accident would have been blamed on, well,
You would have
in
felt
that-
responsible for any
exactly.
accident.
And in that locale, I
Yeah.
they would never I don't think they ever hit a finger, right? But I'm just like, it's my responsibility that you don't do anything.
Yeah.
But you're visually impaired, you're painful, you're this. I'm like, so I make excuses for my dog. Well, it's this close to my practitioner, so I really am. But I'm literally sick, and so having these kinds of things, or if I
Yeah.
ever trained her up on the muzzle, the idea that I would have been like, oh, Gumby.
Yeah, you would have been like, oh,
Gumby,
it'll be fine.
Can somebody get me more coffee?
Yeah.
It would have been different, right?
Yeah.
So having these skills for your dog, regardless, like you said, what size, what breed, whatever. 'Cause
Yeah.
I'll be honest with you, I'm doing this, I'm gonna jinx this thing, doing this for a decade and a half. I've only been hit twice, and one was
Nice.
a freaking Chihuahua.
Oh
Yeah.
yeah.
It
Well,
was a Chihuahua and an e-collar. I'm like, how? Oh my God! Don't tell me
Just
that.
all the cards fell right in that
Right.
time.
Yeah.
Well, I know even like owning, I love my Rowdies. I absolutely adore them to the moon and back, and I'm absolutely in love with this breed. But I am always hypervigilant of my dog's own behavior because I don't want somebody to see an intimidating looking dog, no matter where I am, and think, oh gosh, is that dog gonna bite? Is that dog gonna scare me? Whatever. And so, and Dr. Pastor and Dr. O and I have talked about this a lot with the Rowdies specifically. But as an owner of a bully type of breed, or a breed who has sometimes a negative outlook from some people, it's something that we need to take into consideration. Like, this is something fairly simple as an owner. Yep, this is gonna happen.
okay.
But
Wait.
I may well be under attack. I'm not sure.
He's absolutely terrifying.
He actually lasted pretty long.
I know.
Okay.
Yep, this is gonna happen. Okay.
This
Leave
can work.
him.
This can work.
Here we go. Whatever.
Yeah.
Wait.
Yeah.
But I appreciate that because
Uh-huh.
one of my blind dogs is a boy breed.
Yeah.
And he's been going back and forth to Vegas for his ophthalmologist since he was 6 weeks old. And the idea that, new people, new this, new that,
Yeah.
and then you walk into a huge facility like, I'm not sure if you've been there or not.
No.
A huge
no.
facility like that, it's awesome, right? And all the different stresses, and he's blind, and he's walking through a soup of people that have different attitudes and different this, and different
amazing.
dogs, and different leash lengths, and different restraint,
Yeah.
and do, don't run into anything, and do, go meet new people, and then they get the bug thing going on with him, and he seems fine with it. He's just, he's a blind nibbler, and he's a pit. So the thing is that the idea that the stigma, as soon as he walks in
Yeah.
the door, it's like, oh, like.
Well, and this is one way that we combat that because every vet, every specialist that I've spoken to, I always, whether it's ever on them or not, I always have my basket muzzle with me with any of my dogs when I go in.
Idea, right?
And every single vet is always appreciative of that.
Yeah.
Because, one, they're
Why
going to see a
not?
little bit more. And, it's going to put, I know, so many cookies, but it's going to put everybody at ease. And these are pretty simple things that we can teach our dogs to do to make things easier on everybody. And for those of us who battle sometimes breed bias or an outlook on a particular breed that we own, like my Rotties, this is a super simple thing that we can do to combat that.
And this could be taught in like the exam room, we're talking about.
Oh, gosh,
Yeah, we
Teach
could
the humans how to deal with
Yeah,
the puppies, or
yeah.
as something like a skill
I
set.
think
to
chin
do.
rest, I think.
Oh, yeah.
Or but the muzzle piece of
The
it.
muzzle,
Make
sure.
it a positive thing
Yeah,
versus the whole
yeah.
voodoo thing.
Yeah, and then they come in and they have their muzzle
Yeah.
and, oh, it's my muzzle. Well, this is
We
awesome.
ask people all the time, is it okay if we muzzle your animal? And they can tell the energy changes immediately.
Yeah.
Oh yeah, well, and I think a lot of owners, just because it's not something that's commonly taught, even from a lot of trainers. Like all of my people know about muzzles and the huge benefit there is to teaching proper muzzle conditioning with their dogs, no matter the breed, no matter the age, no matter the size. But it's something that he's shedding a
Good,
whole
you're
lot
back.
right now. It's all the swimming.
I just want to make sure I stay friends with him.
I don't think that's ever going to be an issue. As long as you have cookies, but
well,
it's something that's not it's something that's not often taught, and so a lot of owners they probably will have a negative connotation against muzzles because
Yeah.
the only time they've seen them is with scary dogs or actually aggressive dogs, and so it's a relearning that specifically to muzzles that I think everybody can benefit from. Using basket muzzles and not cloth muzzles, huge thing.
Yeah.
Right? Yeah. Oh my gosh. I'm sorry. Good point, Buddy Crows.
Collar grab.
Yeah, this one's super
Collar
easy.
grab is good.
This was an idea she
You guys
had
both
right
seem
before.
very
Yes.
excited about this.
I love.
This is so simple.
Well,
It's so easy.
it is, and it's a good life
About it.
skill, right?
It's a wonderful
Um,
life skill.
So, and the reason I thought of collar grab was sometimes a dog gets away from me in an exam room. I'm on the floor. I'm like, ah,
They have
rats.
needles on them.
They have needles on them. They're crawling away, and I shouldn't do this if it's a dog I don't know. But sometimes you grab the collar. So if that dog's not counter conditioned to having their collar grabbed, I maybe just did a really dumb thing. So let's just counter condition that. So
Oh yeah. Well, and I see a ton of owners
and
that
sometimes you need to
as
grab
they
your
reach out.
dog, or God forbid your dog gets away and you're
freaking out. Your dog just got away.
I need to grab my dog and I don't have a leash.
When JJ
We gotta grab that collar.
class, she pinned some sheep
Ooh.
in the corner,
Mm.
and the girl who was working with her
Mhm.
reached down and grabbed her
Yeah,
collar.
yeah.
And I got a visually impaired dog, overexcited, sheep in the corner. I'm so excited.
Oh yeah.
Yeah.
She didn't. Once again, a vomiting thing for Dr. O'Sullivan. Like, oh, you know what's gonna happen here? So she reached down amongst the sheep and grabbed her collar. And I was just like, okay, sheep, yeah, that's a bad idea, bad
How
idea.
did that go?
The sheep surrendered, thank the Lord. They did. But this is going to be so important to learn because people do it all the time.
We have
It
one
is.
question
Yeah.
Oh, sorry.
for Dr. O.
Hi.
We have Miss McIntyre, and she wants to know if this technique would work for Chance.
Ooh, that's a good question. I would give it a try. You bet. It's going to be slow, but I would give it a try.
The muzzle?
Yes.
Or, yeah.
So Chance has had a bad rap, and Chance is huge, and Chance has a very scary presentation, but I think that this is a really great idea. How do we need to talk about how to move forward with that, because this is one of our clients.
Okay.
He's huge. He's got his family loves him and will do anything for him, including learning from you guys as to how would you approach this at home to where it needs to be foolproof with this dog, because he's earned his reputation. So, I mean, it's true. So we all have to be honest, like you said, with each other. But yes, definitely. Just give us a call and focus your attention towards Dr. Pastor, and hopefully these two will be working together. But this is a brilliant idea.
Oh, yeah.
And Chance really likes me a lot. So if you have any issues with the mom,
Good.
really likes me a lot. Comes in like, hi, Dr. So, okay, you can look at the ears because I won't let anyone else near me. That kind of like affection. So that's a brilliant question. Thank you, Liz. So we'll wait to hear from you, because
all right.
gosh, that might be a deal breaker for him, right? It could be like a life experience changer for him, because if he could go places possibly, or people would. Wow, thank you. That's such a great question. And then hopefully after Dr. Pastor and Ryan here can talk to you, maybe we can have some follow up with how things worked out for the quality of life.
Or maybe come in.
Oh yeah.
Have an easy visit with the muzzle.
Oh yeah.
You know, come in and get on the scale, have some cookies,
Yeah.
leave.
Everyone wants some.
You know, something really easy.
Yeah. So let's call the office and
Yeah.
hook up with Pastor, because that's brilliant. That's brilliant, because man, that could really be an environmental quality of life changer
You look
for
like
him.
you're about to
Thank
be
you.
flat.
Because I'm
He's
gonna
about
turn
to.
it over.
Listening.
We're going over, folks.
He's just being extra. That happens.
No, that's such a great. I mean, that would be a kingpin test for sure.
Oh yeah.
For sure. That's brilliant.
Well, and even going like talking Chance.
Chance.
Even talking about Chance, like looking at collar grabs, this is where I would start, is with collar grabs. Because even aside from like a behavior like being able to grab your dog's collar without them being uncomfortable, you're actually in a great spot to do this, so thank you. But being able to grab their collar without the dog being in distress at all isn't just that literal skill. There's a ton of pieces. He's like, oh, that feels good. There's a ton. Aaron, come here, please. There's a ton of pieces behind that too. It's a handling exercise, so it's being able to put a little bit of body pressure on your dog by being able to reach and grab their collar. And even dogs who have no negative history, whether at the vet, at home, whatever, you will find quite consistently that if you haven't practiced this before, your average dog, you reach for their collar, they're going to automatically back away. It's not because they've ever had a negative experience, but it's because this has never been taught. Couldn't have timed that better, buddy. Good job. But this is something that's not been taught, and until it is, we haven't taught the dog that this is something to enjoy.
And a lot of times with the collar grab, I don't know about you, but my experience is it's always over their head. I mean, they're always coming in.
Right.
But those intimidating positions with speed, just like coming down, because we're kind of doing that panicking.
Yeah, sometimes we're panicking too if we're, you know.
I mean, whether they're in that whole down, away, and twist thing that they do. Because if somebody tried to grab me by the neck, you know, it'd be right?
Yeah.
So tell me, how is it that you condition, like, let's say a puppy or like a Chance situation, or a dog that's never had these kind of conditioning?
Yeah. So this is even easier than the chin rest. Arrow loves everything having to do with him getting cookies. But the best thing to do, so if I'm holding treats away from the dog. I'm gonna reach to his collar.
That's hilarious.
And reward him as I touch it. So what I'm doing is I'm teaching him that as I reach for his collar, he's gonna be rewarded for it. And so what we're kind of defining in his head is that, oh, somebody grabs my collar, it's not something to avoid, it's something that's going to produce really good results, like food. And so you can see with Arrow, he keeps trying to chin rest on my arm. But other than that, like he got on the table entirely of his own will.
This must be genetic.
What? Did I tell you about him jumping on my collar?
No,
Okay, we'll talk about that later.
This is what JJ used to do. I mean, it's like an Olympian, she just goes.
Yeah, he's entirely to blame for
for
that.
How did you even get up there? She just looked at you like.
That's him. It's entirely
It's
his.
genetic.
I'm sorry.
So,
That's
are
good.
you intentionally doing it like if you're grabbing from the right? I mean, if you gently grab,
Sure.
grab just seems so hostile. Are you pulling his head away from the side you grabbed it on?
That's an excellent question. No, not at all. So as I'm grabbing him, oh my gosh, as I'm reaching for his collar, if you think about the top back here, so on his neck being 12 o'clock, I am grabbing at 3, 6, or 9. You stop. I am grabbing at 3, 6, or 9. Somewhere around there, no higher. Because any higher, no matter the size of your dog, unless they're a 6 foot tall dog that's standing on all fours, which that doesn't exist, reaching over their head, you're going to do with absolutely any dog if you reach for this 12 o'clock spot. So instead, as you're doing this, and actually Arrow being on a platform is beneficial to working on this, just hold on, because I can easily reach for 3 o'clock, 6 o'clock, 9 o'clock, or any, oh my gosh, or anywhere in between. And the reason why we want to do that, and so looking at your small dogs like Duff, I have a 15-pound terrier, any of your Chihuahuas, anything who's a small dog, consciously be aware, oh my goodness, consciously be aware of where you're reaching for the collar. So if you have a tiny dog, go out of your way to not reach over their heads, because I guarantee you every single one is going to back up. It's intimidating, especially as a tiny dog. I don't blame them for backing up.
Exactly, because if I was this big in the world of people as big as me, and I came down, which it happens, right?
Oh gosh,
yes. I mean, it happens, right? Or it happens, and then they do what they do, and it's our, it's our fault. It's our fault.
It's our fault.
Well, and it's circumstance. So I mean, as we have as owners the opportunities to train. Oh my gosh, you're just ridiculous. But the opportunity to train these behaviors, go out of your way to make it easier at first. She has no food. Make it easier at first by doing your 3 o'clock, 6 o'clock, or 9 o'clock. And then as your dog gets really, really comfortable with, oh my goodness gracious, gets really, really comfortable with this, then start to desensitize this. So you can see with Arrow, as I go to reach for this, Arrow's going to leave his head there, I'm going to reward. As I go higher, good boy, I'm going to continue to reward. So breaking it up into 2 parts, desensitizing, reaching for their collar at 3 o'clock, 6 o'clock, 9 o'clock, accomplish that first, and then after that, start, it's not touching my hand, start doing the over the head reach, because that is going to happen, because under duress, you're not going to, as a human, we're not going to think about the ifs, ands, or buts, we're just going to do whatever's quickest, and that's almost always going to be reaching over their head. But you're so ridiculous. But as long as they're desensitized to that, it's not a big deal. I can grab Arrow's collar, and he's not moving around, he's waiting for the food semi-patiently. And I can grab it and guide him and move him as I need to. And I'll use this when positioning him for acupuncture too, being able to use his collar as a guide to, for just like that, where I want him to go, what I want him to do. But this is a super, super simple thing to teach. It's not on a command. I'm not going to tell Arrow anything as I do this. This is something that we want to be automatic. And
is this an everyday training thing, or like the muzzle you had said, do slow things during the day and then spend an extra time once a week, or is this something you would do like
this is something
feed them their meal by kind of?
It doesn't. I don't think it needs to be done that much, because it is a very easy thing to teach and to pair. But this is something that will happen as long as you're diligent with it, very, very fast. So you can do a couple sessions of this with your dog and completely redefine their expectation behind their collar being grabbed.
We got another question for you guys.
Oh, okay.
We have someone who has a Staffy that they found last year. They have no clue of her history, but she gets extremely submissive when they grab her collar. Would treats be a good way to positively reinforce when I do that?
Absolutely, and the best treats to use are something that your dog's going to go absolutely bananas for. Like even with Arrow here, Arrow is a dog who's used to working for what we would constitute as low-value food, so like kibble, things that he gets every single day. But in here today, I'm using super high-value stuff, hence all of the drool and enthusiasm. I did that on purpose, because as an owner, not just as a trainer, but just relax, but as a dog owner, I want to make sure I'm best setting him up for success. And so if I'm going over the top with my rewards, that's just chill. That's not going to cause any issues other than over enthusiasm. So as you're working with your dog, the first time with any of this, the first at least few times that you spend working on this, use high value food. So even wet food, but raw food, dehydrated raw food is one of my favorites. I have my Stella and Chewy's dehydrated. It's fantastic. Or freeze-dried. Freeze-dried.
Yeah,
freeze-dried.
Stella and Chewy's freeze-dried, yeah.
Wild weenies, man.
Yes.
I love those things.
And then
What did you say?
Wild weenies.
I have no idea what those are. I mean, I can
No,
imagine.
they're-
It's a sell on Shoe Street.
It's the same company. They're just like little
It's an
sausages.
Yeah.
I
One of the
always still on Chewies in the Giganto bags. You know,
That's what this is
and then I
about.
just, like nothing small, just Giganto bags, and then break them up. You know, so
Yeah.
I've never heard of what.
Yeah, they're in the store.
I digress. Back to him.
Right.
So
We've
how-
got
how do we
another
help-
question.
I like
Okay.
it.
Oh, we got it.
Okay.
Okay.
Do we send this woman with the anxious pity to you guys to talk about this? I
Yeah,
think so. I
absolutely.
think so.
Yeah. Well.
I think so.
Yeah.
Short answer is yes, it will, but use high value food.
Okay.
So really good stuff. Thank you, Steph.
So this is a really great question. So with curbside service happening at the vet office,
Mm-hmm.
what are some things that the owner can work on with their dogs to help them go with the stranger, quote unquote, or the vet tech or the doctor, to make them go into the building easier without the owner,
Really good
instead of them thinking they're being tortured or drug away from their owner?
That's an awesome question, and this. Relax. The food will come. I swear. Oh my God, never. It doesn't matter how fast it is, it's not fast enough. But the easiest way to do this is to, and this might sound silly, but is to set up mock vet visits at your house. So have a trusted friend come over, as long as your dog is safe with new people. Have a trusted friend come over, take them by the leash, just like one of the techs is going to, just like one of the vets will. Will you stop offering?
Have them put a mask on.
Have them put a mask on. Set up the scenario just like it was a vet trip. Drive to your friend's house to do this there. Have them walk the dog in and then walk right back out. Just very nonchalant. So creating no negatives with it. If your dog's happy to take food, then have the friend offering them food the entire time. As long as your dog's not going to the vet for something that requires them to be on an empty stomach or to not have any recent food in their system, always check with your vet first. But hand your tech treats to give your dog that they like. They will.
Yeah.
As long as it's
Yeah.
not impacting anything in the visit, there's no tech on earth who's going to say no to that.
Yeah.
Make sure it's not impacting anything in your visit. Ask
Right.
first.
Right.
Ask when you book the appointment. But this is a super simple thing to help recondition a positive experience with the curbside aspect. And believe it or not, most dogs are going to be, in my experience at least, less stressed with the curbside part.
Yeah.
Because as we talked about earlier, like Dr. O is an owner, being super nervous about her dog, with you not being super nervous next to your dog, that's automatically ticking off a box from
Down the
that.
leash,
Let's be
man.
super
It's
nervous.
100% down.
It's
True.
awful.
100% down the leash.
Ask Dr. Pastor. I'm awful. I'm really bad, especially when it comes to him. I'm awful.
Well, the thing is,
It's embarrassing.
It's like, well, you know, everybody here
There's a
knows.
giant cloud of fur that just went with you.
I was mama bear mode.
It's
every
awful.
second of every single day I was like, okay, you know, don't look, don't touch.
I break all my own rules.
But the thing is, we at Bark Avenue started some dogs, some techs, some doctors have decided or wanted to ask clients about doing happy visits to where
Yeah.
Please do happy visits.
I like that name better. Happy
Yeah.
visits.
And the thing is that you know you treat at the car, treat halfway to the door, go back to the car, come to the front door. You don't go in the front door. You have a couple treats, a couple thousand treats, and then go back with your parents
Yeah.
and trying to get those happy visits
Yeah.
in where nothing bad happens, and you always go back. Your parents didn't abandon you. I think a lot of anxiety issues that we're having in the office is abandonment issues,
Sure.
just because. Where the hell did my parents go?
Exactly.
And
Yeah.
it's like that,
Yeah.
being dropped off at the pound kind of mentality in my head. So like, where are they, and how come they've been gone for so long? And that some of their FAS just continues to go up, and
Yeah,
those dogs
yeah.
that start like, are they ever going to come back? Or that wind up, right?
Shoot.
So that's okay. Do I need to burp you? Okay.
Oh, it's coming. Okay.
Yes. Okay. Good
Thanks,
job.
I appreciate that. Let's discuss
Can't
that.
have an emergency.
Keep it classy here.
Film.
I know, right? Let's practice cooperative care. Oh my gosh.
No emergencies on film here.
But it's all about, I mean, looking at that. Like, I do a ton of happy dog visits, even with my adult dogs.
Oh, yeah,
We'll do visits, or I'll bring, if Arrow
Or
has
bring-
an appointment,
yeah.
I'll bring
Someone
one
else,
of my other,
yeah.
one of his housemates, and I'm just giving them a bunch of food or playing with them. I've always got toys with me. I bring more stuff for them than I do for me when I go to my concert. I also
Well, yes.
do way more for them than I do for me, but that's a whole other story. But it's all about doing whatever is preferred for your dog. So if you you're such a good dog. But if your dog's a toy motivated dog, bring squeaky tennis balls.
Yeah,
Bring
that's true. We didn't even talk about
tug
toys.
toys. Bring what is motivating to your dog. For 99% of the dogs, it's going to be high value food. But the first couple of times you do
Another
this,
one?
especially with an adult dog, it's going to be like, expect the first couple times you do this on site, they may not want to take the treats at first. That's okay. Just sit there and hang out. Just hang out, make it a positive experience, and then go.
We got next question.
What else?
I have a beautiful bull terrier.
Yeah.
Since COVID, she has gone through her first heat cycle, and they have moved.
Oh, great timing.
Yeah. She's become extremely protective. She barks, growls at anyone unknown. How can I help her socialize and realize she is safe among all this world and home change?
Call us to set up an in-person consult.
Yeah, that's.
Because anything with that, so when you look at breeds that can be naturally protective, and despite Arrow being a giant mush bucket in here, Arrow is absolutely a protective dog. He's protective over my home, he's protective over me when the situation calls for him to do so. But he's never protective when the situation doesn't call for it. So if we're dealing with a dog who is being protective and the situation doesn't call for it, and if you don't know what that is, then it's not that situation. If somebody's trying to break down your door, they should be protected. That's normal.
Hope so.
But if you're unsure, then assume that it's not a situation that your dog should be protected in. But if we're dealing with a dog who's showing those sorts of behaviors in a situation that doesn't call for it, there's something else going on, whether it's a confidence-based issue, insecurity, pain, hormonal. It's very common for heat cycles to trigger some behavior shifts.
Yes, it does.
Sorry.
I think
Especially in the first. Sorry. I warned you.
That's the first time in my life I've been to that. And I'm like, what's the matter with her? What is she doing? I mean,
What did I tell you?
So
I said I was sorry.
But the thing is, the truth of the matter is, it's not like you don't act the same way too, O'Sullivan. So back
I
off.
did not say that for the record. I did not tell
The men
you.
in the room did not say that.
Because that would be unsafe for them to say.
Oh, very much so.
But if this dog's a bully breed, is that correct? A bull terrier?
Bull terrier.
Bull
Yeah.
terrier, yeah.
So it's like a double bully breed, then, isn't it? A bull terrier.
He's
And
got
then-
all the energy in the world.
And then in heat, move the
It's a
move
trifecta.
moved, yeah,
That's
and
a lot of
the
stuff.
anxiety and those
A lot of
types
stuff
of
to
things.
have
I
to deal
can't
with.
imagine the hormones. And, oh my gosh, yeah.
But the good thing is, there's absolutely things that can be done from a training and from a behavioral standpoint. I just need to see the dog in person so I know what to do with that particular dog. Any good trainer is going to tell you that what to do in the case of behavioral issues depends. It depends on the dog. It depends on the dog, it depends on the circumstances, there's a ton of variables.
And owner compliance. And
That too.
it's a huge investment, isn't it? I mean, like learning how to do it yourself is one thing. Doing it consistently, and it's hard. The consistency. So
He's just kidding.
a little tap dancing going on there. That's a good question. Very good.
Yeah, that is a good question.
So what else do you need in the office,
Oh.
Pastor?
Well, so we're on the table.
Yes, we are.
So I'm gonna just pick. He decided to change my plan here, which is fine.
Sarah.
Because the other thing I didn't have on the list, but I think is really cool, is just teaching your dog to lie flat.
Yeah.
For
You like this one.
an orthopedic exam. I mean, that would be amazing. Dog's laying right there. Like this. This is perfect. I'm behind them. I've got their legs. I've got their spine right in front of me. If they can be comfortable laying flat like that, that's so much easier than, hey, tech, pin this dog down for me. We don't want to do that anymore.
Well, and even looking at that, allowing any manipulation with joints is a huge one.
Yeah.
And I know having a breed
Just
that,
being used to range of motion.
yeah, having a
would be
breed that
huge.
can be prone to cruciate or joint or any other kind of issues, and that's really any large breed. Rottie is super common, your Shepherds, Danes, so on and so forth. Stop it. It's super common. Oh no. I dropped the cookie.
Treat down.
But, oh no, stay on there. But, I need my own
Stuff
joint
anyway.
and range of motion exercises. But I'm going to adjust Arrow a little bit. But
So
there we go.
like to train any dog how to lay down, like doing lateral recumbency, I've never even considered.
I just started playing with my 3-year-old because the other ones already have a little bit of a negative association with me manipulating them. So I good job, Pastor. Right?
You broke your own rules.
But the youngster, she's getting it, and I'm just trying to keep it positive. But yeah, that's
And
kind of
the-
what I'm doing with Honor.
Well, just watch your face. But it doesn't kick you.
Get a black eye.
But you can see with Arrow, like he's comfortable with extra gusto, which is just for extra credit. But and he's shedding everywhere. At least you're wearing black.
Good, I'm all black with the bottom black.
But looking at, like, even if we take the front leg, the way that I am not a vet, I'm not a vet tech. I don't actually know what I'm doing with that part of it. But to desensitize, this is my disclaimer. But supervise your staff. But to get a dog used to range of motion stuff, and this is me doing it. I've got treats on me, treats are in my pocket. But don't start with trying to just move around your dog's joints, because they're probably not going to like that. If they're not, Arrow doesn't care at all. But he's used to it. I've done a lot of this. But even to start, you've got your dog used to being on your side, on their side, let's assume. If I start with the front leg, I'm going to hold the front leg and then give my dog a reward. I'm not moving any. I know, I said, it's right here. Yeah, honey. Oh, there's cookies. But I'm just going to hold the leg. So again, he loves it. Just come back. But collar grab. Practicing that restraint. Good boy.
So what you just did there, I mean, literally, you're a dog, like I was going to say a virgin dog, but a dog that he has learned to sit and has to learn to lay down.
Yeah.
And you're doing kind of head wrap with
Yeah,
the
yeah.
body on the side. So those are a lot of
Yeah,
training
so
things
there's
that
some, I guess, some foundation.
Yeah, and so all I'm
skills
doing
to
with
go
Arrow,
down.
Arrow knows how to get on his side on command, but it's right now quicker if I just guide him since I have watch out. The feet are towards Dr. O. You're
Okay.
blocked.
Oh, okay, you going that feet that way? All right, I'm good.
That's his preferred side. It's right sided.
know.
But if you take a piece of food and guide your dog's head around as if they're an owl. I was going to say The Exorcist, but if they're an owl, you remember it though, right?
Yes, it's burned in there now.
Sorry. But I'm going to let him follow the food that's in my hand, and he's going to turn on his side.
Beautiful.
And good boy. He wants to do it again. So we're gonna do it again. He's laying down, turn, Arrow's gonna lay on his side. And so, oh my gosh, too much. What I can do from here, so Arrow's nice and relaxed here. I mean, mostly he wants more cookies. But grabbing his leg, getting him used to the restraint, and I'm not holding forcefully. That's an important part too. If at any point Arrow were to flinch his leg away because he's uncomfortable with it, I'm going to let go. I'm not going to try to keep holding no matter what he wants to do. That's how you create dogs that are uncomfortable
Because
with
the
it.
dominance thing no longer plays.
It does
in
not.
Dog training, right?
Correct.
Right.
Dominance
No
theory does
alpha
not
house,
exist.
alpha
Like,
crap,
if
or
anybody's
the-
taking notes, highlight this. Dominance
It's
theory
funny 'cause
does
people
not
still think
exist
that.
with dogs. Yep. I can't tell you how many owners I've had that are trying to pin their puppies and just make them get used to it.
And the eye
that's
stare and those types
how
of
you
things.
create issues. If I can teach my, I don't know how much he weighs, 90-something pound Roddy to do this with a giant smile on his face, and he's just a little bit smaller than me, anybody can. Like, this is very simple behaviors we can teach our dogs without the use of force, making them comply. Arrow does this because he wants to, because I've brought value to it. And that should be the goal in, to go way over just cooperative care, that should be the goal in any kind of training, in any kind of pet care, is your dog's doing this for you because you have a good relationship, they trust you, and they want to.
The trust thing is so important, regardless
Huge.
of because I mean, like what you and I do with our, with the needles and things like that. You have
Yeah.
painful animals, and you walk in with a bottle of needles, and you're
Yeah.
like, especially with cats, you're like, hey. And I think it's a human being came up to me and said, trust me, the first thing I'd be doing is like, well, it'll be worse than that, right? But with the cooperative care, and if an owner, such as myself, who doesn't do any discipline with my dogs, we do food training, things like that, to get that like stop, hang out with me, sit, and then lay down, and then this, and in a multi-step thing at home, in order to be able to reenact it at the doctor's office
Yeah,
without higher
yeah.
stress.
Yeah.
Okay.
And practice these things at home. So like at home, I have a platform built for my dogs. I have a grooming table. I have specific spots in my home that I use, especially with young puppies or dogs that are staying with me to train, that we are like practicing kind of in mock scenarios these sorts of skills. I've repeatedly scheduled fun visits with the dogs just to go in there and have the vet there kind of as a body, whether they're doing anything or not, just to mimic the scenario. I had a dog of my own who was deaf, who was just a little bit nervous about the vet environment. I got him when he was an adult already, so I didn't have him as a puppy to teach him the things that I did with Arrow. And so he had, before he had his actual visit, he had 3 or 4 just fun visits where he came in just to do these things, just with a vet there, while I'm rewarding, treating, and there's no pressure. Nobody's
Did you
gonna
bring him in only with you as a human, or did you bring him in with a dog buddy? Remember you were talked about that, going into 2 dogs to a
I did bring him
like
with a dog buddy.
Yeah.
He and Arrow were best friends.
Yeah, I think he came in with Arrow a lot,
mhm.
and maybe Rue.
Well, it's kind of these guys, in my opinion, they feed off each other with confidence.
Oh, 100%.
Because
Yeah.
you have these big confident dogs, not just gigantic.
Oh, gosh, yeah.
Not big dogs. I mean, but it's just confidence, and these dogs that walk around and just like, I'm just not afraid, and that it oozes, just oozes into the other patient. Like if
You're
my
ridiculous.
big friend's not afraid, I'm not afraid. If they're gonna go in here and everything's gonna be fine. That learning that kind of confidence, just from attachment, I find that it's really, really nice, especially like that big black lab I have, and those puppies that come into my, watching her do 4-legged education with these puppies, it's like, I'm gonna stay out of this, and then they just become more confident, and it has nothing to do with me, it's just that, just feel more comfortable where they're going, who they're seeing, those types of things. I think it makes all the difference in the world. And then having these animals that come in as adults and they don't have confidence, just like maybe some of the folks who have been calling in today.
Yeah.
I don't know how to build that. I don't. But you guys do. So I think it's really important that people know to contact you guys either directly here or through you, but to just teach people fundamentals. Because these guys are so important that they're somewhat confident in order to get the skills ready that you want. You want to have some of this cooperative care in the office in order to have these skills in a strange environment. Some sort of self-confidence, I'm guessing, will be warranted. So, are there other things, Dr. Pass, that you'd like to see? I'm thinking about what you're talking about, having this dog any dog on its side. Teaching it to sit down, whatever. Your patients are painful. We've had last couple of days where like laying on the side being a lateral appendix, and like, ow, how are these guys doing that? And that even, with that touching the leg and then positive reinforcement, I think that would be so important, especially with these guys that being in lateral recumbency, depending on what's going on inside that we don't know, it might be very difficult for these guys. I mean, just pain-wise, right?
Yeah, that's true.
That's fantastic. Did you see it? He's like, yeah, I gotcha. So
maybe he can back the target.
What about doing like pain management on these guys? You're training them to try and be in lateral recumbency and be more comfortable. But like before a visit, talking to owners about doing like maybe some pain management before they come in. So just like make it a whole program, right? So that the visits here, you're fear-free, your cooperative care, everything kind of work together so that everything is
and sometimes and we also have our pre-visit pharmaceuticals at our disposal when we need them.
We have fantastic pharmaceuticals.
Yes, we have fantastic.
And that's also something like as an owner, I know even before I met people like Dr. O and Dr. Pastor. Oh my gosh, I can't take him serious. But I had, as a dog owner, a not positive outlook to using pharmaceuticals preemptively with my dogs, or with client dogs, with owners that I'm working with.
Or supplementals, they don't
and we actually don't, I don't know a lot about the supplements that we can use, but there's a lot out there. There really is, and we can even start with those first.
And not at all unlike everything else we're doing. Whatever is appropriate for your dog in order to make the experience less literally painful, more relaxing, not traumatizing, and to make everybody's lives, yours, your vets, the staff's, your dogs included, better, is what you should be doing. So if your if giving them a supplement, giving them a med before, as prescribed by vet, before they go into their appointment or consult, whatever the case may be, I talk with my hands entirely too much for you, but it's funny. But it's nothing to be, as a dog owner, worried about. I think a big part of our dogs' trust with the veterinary staff also goes with ours. We have to trust our vet staff as well.
Duh.
And if you don't ask your vets questions, I push this on my owners all the time. Ask your vets questions. If there's something that you're just unsure about, ask them. There's not a vet on earth that is going to be unwilling to answer your questions. And if they are, call Bark.
Well, the thing is, if the owner's not comfortable, then
The dog's not gonna be
you have a bad
comfortable.
relationship,
Yeah.
so go someplace else. I mean, even
Yeah.
if it's not us, go someplace else
Go
until
where you're
you're comfortable and then your pet's comfortable, because all the different reports that we have with these guys and the humans, if you're not comfortable and we don't click, then go someplace else, because we can't get good medicine if we don't have
No.
a good rapport with the humans, for sure.
Arrow, he thinks you have food. Ew.
I don't actually.
Arrow, I have food.
You're back to
Fine.
our sweetheart.
Oh. So dramatic. Oh my goodness.
All right.
Don't
How
do
I
it.
think we're out of time. We went over.
Say goodbye. Thank you for joining us.
More
everybody.
questions, or are we good?
Please send all your questions.
We answered all our questions
We
thus
answered all our
far.
questions.
Yeah.
All right.
So we are going to stop our Thursday morning sessions. We are going to move to a YouTube platform, and we're still going to be uploading videos pretty frequently. So look forward to them. If you have suggestions on what you'd like to see, certainly give us an email out to Dr. O. Sullivan at barkatpet.com, myself at ron at barkatpet.com.
Dr. Cat, what's your?
If you want to keep these live sessions
what my work
going,
one is.
all you got to do is let us know, and we'll continue those. But just send me the feedback, comments, suggestions, emails, so we know exactly what you guys want to do.
Thank you very much, guys.
Great questions, guys.
Thanks.
What?
Say goodbye.
Good job, Arrow.
You shed
Say goodbye,
everywhere.
Arrow.